now turn this particular session over to Dr. Courtney Calidora-Manthe, whose pronouns are she, her, to present improving public health data accessibility and trust through Indigenous-guided research practices. The floor is yours.
Wonderful, thank you. All right, and I'm going to do the typical Zoom. Can everyone see my screen? Hopefully. All right. Well, hello, everyone. Thank you so much. And thank you for that introduction, Anne. As Anne had said, my name is Courtney Manthe. Now, I'm going to be talking about some work that I had done in Samoa. And throughout this presentation, you may notice that I use the biological sex female and the gender woman, at the same time. And that is because the research that I conducted was done in Samoa, where there are actually 3 genders, but the participants who I worked with has asked me to refer to them as women. So out of respect for that community, I will be saying women, although I do want to recognize that gender is a social construct and biological sex is, biological. And so, yes, without further ado, so in 2024, I was selected to serve as the project manager for an NSF-funded project that was co-led by the University of Alabama and Baylor University, titled "The Effects of Shared Markers on Identity of Identity on Inflammation and Stress." And this project was really aimed at looking at that intersection between biology and culture. And so, what better way to look at culture in Samoa but to look at traditional hand tap tattooing, also known as tatau? So, as you can see in our picture, this is the Pea tatau. It is a traditional rite of passage. So, this is a very sacred tattoo that only some select members of the community may receive. And so we wanted to look at tatau and also the inflammation, biological indicators of stress that individuals were experiencing when they were receiving this sacred rite of passage as a way to see if, culture and biology had some interplay here. Was the inflammatory rate going to be lower compared to those in the United States who were receiving tattoos that maybe didn't have as much meaning? And of course, that's not meant to say that tattoos in the United States don't have any meaning, but I'm sure we all know somebody or have even been there ourselves where, you go and you get a tattoo that maybe wasn't the best idea. And so, in order to get a holistic view of this culture and this potential intersection, I was brought on because of my background in molecular biological anthropology or genetics and maternal and child health. And so, I also wanted to incorporate questions about menstruation to understand, that feedback loop. If an individual received a tatau and they had heightened inflammation, was it potentially impacting their menstrual cycle? And could we have some comparisons with individuals in the United States? Now, for context here, menstruation questions were included in our survey. So we, did a survey and then we were collecting saliva samples in order to later run ELISA testing to understand, inflammation rates. And so menstruation questions were included in our questionnaire as a way to get a better understanding of reproductive health in the region. So cycle length was a huge question where we had said, how long is your cycle specifically? And this was translated into the Samoan language, though many individuals in Samoa are bilingual. They do speak English and Samoan. But, in order to make this survey as accessible as possible, we did have it translated and it simply just said, how long is your cycle? And, some of the backing for this was because we do have some collaborators in public health at Yale University who have indicated in some of their reports that infertility rates in independent Samoa may be as high as 90%. And so this was a hypothesis. So we wanted to kind of explore that a little bit, and aim to better understand and interpret variation in our female health outcomes. And so why does this matter? Why does it matter? We did a survey, we, talked to some people, we got our biological samples for many of them. Well, In many contexts, public health data and public health research are shaped by Western frameworks. So many individuals are trained in the United States. They are taught how to conduct research in a specific, certain manner, and then they go off into different regions and apply that methodology there where it may not be culturally appropriate or even relevant. Additionally, with our health data, in many cases, sensitive topics are frequently underreported. And, in the United States, many physicians will just come out and say, "What's your menstrual cycle like?" So many of us are conditioned to see that as something normal, something that, is part of a routine healthcare appointment. However, in many regions, questions about sensitive topics like menstruation are highly inappropriate. And so gaps in our data mean gaps in our care and policy. Because if we do not have that holistic picture, if we do not understand what is going on, how are we meant to properly, aid with care and policy implementation? And so this is where we need culturally grounded approaches to not only our data, but how we are conducting research. So, in our first round of surveys, 64% of Samoan women declined to answer menstruation questions. And for all of us who have conducted research, we know you cannot force anybody to answer questions, of course. And so, having all of these surveys left blank for the entire menstruation section meant that, we had nothing to work with. And so we went back and tried to figure out why. Why did this go wrong? It's something that's, routine. It's something that many people talk to us about in the United States. And the first was discomfort with the topic in general. It is a highly sensitive topic and not something that you speak about with somebody outside of your family unit. So to have a researcher coming from a completely different country who does not speak your native language asking you about this sensitive topic makes sense that people would not feel comfortable answering. Additionally, the language that was used in the survey was highly clinical. So, asking how long is your cycle length? That was unclear language, and we actually had this translated by someone who was assigned male at birth. And so, their translation was also the masculine form of cycle length. So, not only were our questions, something that was highly sensitive, but something that didn't quite make sense. And lastly, we learned that the presence of male and foreign researchers also increased the discomfort with that topic. So, this topic was so highly sensitive, it was something that would not be spoken about outside of one's family, especially if someone assigned male at birth was present, even if that male was part of the family unit. That is something that is highly, controversial. It is taboo. It is looked down upon in the specific region. And so, what this revealed to us, first and foremost, was a misalignment between our survey design and cultural norms. And although we had the best of intentions, we were so honored and grateful to be there to be able to conduct research, we still fumbled and had that misalignment. Additionally, Western instruments do not translate directly. So, asking about somebody's cycle length, while that is something that is normal here, it is something that many are taught in their research design classes, especially in graduate school. That is not a universal. It is something that is, regionally specific. Additionally, our non response patterns also reflected structural inequalities. We noticed that those who did choose to answer these questions came from a higher socioeconomic status in the village, which related to their social status. So, those with privilege, those with power, were more open to talking about something because although it may be taboo, although it may be something that's not normal, they had that extra layer of protection compared to those who were at a lower social status who, didn't have that extra cushioning if maybe they did share a little bit too much. And so, some voices were excluded. And so, if we were to take that data, even though we had some, it was very limited, if we were to take that, so many voices would have been excluded and our data would have been incomplete. So, this is where we brought in that Indigenous Data Sovereignty framework. Now, Indigenous data sovereignty has somewhat become a buzz phrase, in the past 20 or so years, where many projects are claiming that they are using all of these different frameworks. However, by the time we learn and, master a certain framework, a new one has emerged. So with IDS, things are continuously changing. But some things that have not changed are first and foremost that IDS relates to, community control over their data. And this is not just biological data. This could be cultural knowledge, this could be their language, any type of data that relates to a certain community. It also prioritizes culturally grounded research practices. So, having authentic community engagement, speaking to individuals, and having real relationships, not just checking a box that, somebody who identifies as Indigenous has been added to the team and will be some type of consultant or a collaborator, right? Having a true, authentic relationship. And by doing this, we can support ethical, equitable data governance. We can provide data to individuals in a way that is useful to them. And so, in many cases, researchers will go in, they will work with the community, they will come back, analyze their data, write a publishable paper, possibly publish it, and then return and say, here is your paper that is likely not in your native language, or maybe there's a little blurb saying thank you in the native language. Here's your paper. But that's not useful to many communities. That is not something that people are excited about or they can really do anything with. And so by using the IDS framework, we are able to find a way that people are actually benefiting from the research that is being done in their community. And so this helps us move beyond the historically extractive research models that we often see in anthropology specifically. And so moving forward, we did some community guided adaptations. So we had true collaboration meetings with individuals, so Samoan scholars from the National University of Samoa. We also sat down with village matai, which would be chiefs. We consulted with women's communities. So these would be groups of women in certain villages who are respected, who are trusted. And we asked them, what do we need to do to be more culturally grounded? What are things you want to see? How could this research benefit you? Are there questions you would like to have added? And would you be willing to translate this and also to maybe sit in and to help train those who are conducting interviews? Tell us, how are we asking questions wrong? Is my pronunciation incorrect? I am not trying to be offensive if I, misspeak or if I say something wrong. So can you help me with that? And then we also partnered with the OLaGA Study Group, which is a group of Indigenous women who are Samoan research scholars, absolute rock stars. So my shout out to the OLaGA Study Group, who, goes into villages. They often work with Western researchers as a liaison to assist and to help these Western researchers have that proper training so they do not, unknowingly cause discomfort to participants. And so, with all of this, we co designed the research process. We threw our entire survey away, and it took us months and months, but we rebuilt from the ground up with true collaboration with, many of these individuals as a way to make sure that our project was community guided. So, some specifics that we changed, just to name a few, are first, we revised the question wording to use local language norms. So, asking somebody about their cycle, we would ask them specifically, how long are you bleeding? How long is the time in between bleeds? But in a culturally appropriate way. All interviews were then conducted in Samoan. So we did have translators come in who identified as women in the community, so Indigenous women scholars. So they were the ones actually conducting the research. Conducting the interviews. We also matched our female interviewers with female participants. So those who identified as male were only matched with male interviewers. Those who identified as female were only matched with female, interviewers. And we also ensured that those assigned male at birth, especially those from our team, were not even in the village on the day of the interview. And we also strengthened that community governance over the data. So we ensured that, everybody had passcodes. They would know exactly where the data were going, exactly how we were going to process all saliva samples. And then we did do a formal agreement with the Ministry of Health to give all data ownership to the National University of Samoa and the Samoan government. So while we were doing the collection, we were basically doing the data collection as a way to kind of hand it over to the Ministry of Health and then for them to decide what we could do with it. And that means posters, talks, publications, even my talk here today had to be approved by the Ministry of Health, the National University of Samoa, and also the villages and the participants, every single participant that we spoke with. And so our outcome was we then had 100%, a 100% response rate on all menstruation items. And this did include questions about infertility, stigmatization, and feelings of community standing when one was having trouble conceiving. So this improved our data completeness and it definitely increased our participant comfort. So many participants were asked, do you feel a bit more comfortable, especially those who were generous enough to return. So we did have some return participants who had been part of our initial data collection process who weren't necessarily comfortable. We reached back out, said, hey, these are the things we've changed, and they agreed to participate. So we did converse with them and say, was this helpful? And we were told yes. As a matter of fact, it was, the reason that they chose to return. And so overall, it strengthened that community trust. It made people feel like they had control over the research that was being done in their community. And what we found was 87% of participants had irregular menstrual cycles and were struggling with some type of infertility. And so, why does this matter in public health? We're talking about Samoa, which is a region in the Pacific. The time difference is so great. It's actually already April 18th there. So, why does this matter? This is a project that we did. How can we apply this, to our community and our state of Colorado? Well, with better data, we have better health insights. Additionally, we can increase participation from traditionally and historically underrepresented groups, which is imperative in public health to improve health equity in our beautiful state. Additionally, this can help us design more equitable research practices. Just because research is being done in the United States, where some of these things are the norm, doesn't mean that they make everything equitable, right? We need to make sure that even if we are in our own backyard, we are being culturally appropriate. And through this, we can help strengthen our community relationships. And so Colorado is home to many diverse communities with very distinct cultural frameworks for health and data. And some of these populations include, but are not limited to, American Indian and Native Alaskan communities, Native Hawaiian and Pacific Islander communities and populations, and then also refugee and immigrant communities from Africa, Southeast Asia, and the Middle East. And again, this is just scratching the surface. This is just to name a few of the wonderful communities that make up our great state. And so many of these groups are underrepresented or even misrepresented in public health data sets. And this is not to villainize these data sets, but it is just something that has historically happened and must be changed as we move forward. So standardized survey tools may not reflect culturally appropriate ways of discussing sensitive topics like menstruation, like infertility, like stigma, or even cultural practices that are maybe incredibly meaningful to one community, but could potentially not have that same meaning in other communities. So when we use this one size fits all cookie cutter survey tool, we are not fully understanding the population. In anthropology, we call it the principle of holism, and that is where we take that holistic approach. And with our standardized methods, we are not doing that holistic, work. And some barriers that often happen with these standardized practices are, barriers with language. So maybe things are not translated correctly, maybe they're not translated at all, or maybe, they're not using terms that make sense to that community. For example, thinking back to our project, we had someone assigned male at birth translating everything into the masculine, which did not apply to those assigned female at birth. Additionally, there could be issues with trust. If a community has historically been, mistreated, misrepresented, they're most likely not going to be very eager to have a researcher come in and ask them questions about sensitive topics or about their life. Additionally, this often leaves out historical experiences. So if we think about the structures in place that many of these cultures have, formed under, we can think of our political structures, our, historical structures, economic, things like that. They all have an impact on culture. They all have an impact on how people are adapting to their environment. And so with these standardized tools, we are missing a huge chunk of that picture. And of course, with research design, if it is not something that has been designed, with that community, it is very likely that it will not be appropriate culturally, and that the data will not be, as um, as complete as it would be if there were a community member or members part of that process. And so opportunities for strengthening public health data practices can come from this. So as I said, many public health systems rely heavily on standardized survey instruments. And there often is limited adaptation of sensitive questions in order to reflect that cultural context. In many cases, we are all on a time crunch. We all have, budget constraints. We have somebody saying, when is this publication coming out? We all face those challenges. And so that can make time very difficult. However, if we are not reflecting that cultural context, we are not adapting our research instruments. And then we do run that risk of missing parts of those pictures. Additionally, some of these communities continue to remain underrepresented in key data sets that are used all throughout the world. And so this actually provides us an opportunity to strengthen that trust between the communities and institutions. And so by, talking about this, how can we apply this to Colorado? How can we apply this to our public health research or our own data sets? What can we do? And the first is to co-design surveys with communities. While it does take extra time and it does take, quite a bit of time to build trust with that community, ensuring that surveys are, not just these one size fits all things that have been sent out for decades, but actually taking that time to, build these surveys with communities. Use that culturally relevant framing, match the interviewer and participant when appropriate, and then build those community governed data protocols. So some practical strategies that we hope that you will consider is to partner with community leaders and organizations before the research process has even started. Before somebody is coming in, with their survey that they've sent to their IRB, they've gotten approval. Actually speaking to that community to earn their trust and to also build these long-term relationships, not just a one-time consultation to check that box. Additionally, pilot test with target populations. So maybe conduct a small scale test to identify maybe some confusion or discomfort. And this could be even with community leaders, say, this is our survey, this is what we aim to ask, and, this is how we want to go about it. Is this appropriate? And if not, refine that wording, refine that delivery, that format, refine anything that could potentially cause somebody discomfort. Because if we think about it as researchers, we are aiming to better the world, right? We are aiming to add little pixels to the big picture here and to help people. And if we are causing discomfort and unknowingly causing harm, we have just taken 3 steps back. Additionally, adapt, not just translate survey instruments. So in many cases, individuals will, work with a population where maybe, they speak a language other than English. So they will hire a translator, they will translate their survey instruments and then administer it to the community. However, questions must be aligned in culturally meaningful ways, especially in discussions of health. So there are so many communities that will speak about health in a completely different manner than they will speak to you about their food preferences or their family structure, or even, some ritualistic behaviors. Health is often something, especially in my work in the Pacific, that I've noticed some patterns. It is something that is spoken about very differently than other things. And so recognize that a direct translation may miss context or nuance. How many times have we been on Google Translate and maybe you type something in and you're like, what in the world was that? That happens. So have these partnerships, have real people translating and telling you how to phrase things. Additionally, match that data collection practice to participants. Again, consider if you're having an interview, especially if it is surrounding a sensitive topic, consider things like gender. How is gender viewed in this culture? In the United States, traditionally and historically, we've often had two genders. Things are changing, but there are many regions where there are three or more recognized and accepted genders. So if you are to come in there and say man or woman, they may look at you like you've missed something. So consider things like the social context of gender and biological sex as well, maybe language and then cultural familiarity. If we come in with highly clinical language, a layperson may not understand what you are asking, and that can lead to feelings of inadequacy, elitism, things like that. And so, ensuring that it is all culturally relevant and appropriate for the participant. And additionally, pay attention to the environment. Create an environment that can support comfort and openness rather than, having a line of people and asking them questions. If it is a sensitive topic, ensure that it is a private space where somebody can feel comfortable to open up. Additionally, ensure transparency in data use and sharing. Tell everyone, what are you going to be doing with these data? Are you going to be publishing papers? If so, where? Who gets a say in reading the paper? Do people get to sign off on it? Who is a co-author? Who will benefit from this? And how will they benefit from it? Now, in terms of long-term storage, where will these data be stored? Will it be password protected? Who has access to this and how can it be shared? And incorporate that community input in data governance and decisions, right? If the community is saying, we don't want published papers, you may publish papers, but we want you to come here. And in my specific context with this project, publishable papers were not something the community wanted. Rather, they wanted us to come and do a seminar in their native language and to share all of our findings and also to offer some ideas for strategies for health improvement, and to also bring in other members of the community who are healthcare providers to work together to have a large seminar, for health improvement and equity in general. So having that transparency and, providing data in a way that, benefits that community. And lastly, prioritizing the community benefit and reciprocity. So as I've mentioned, many of us are under very strict deadlines. Many of us have people at a much higher pay grade telling us we need this many publications and when are you going to be in the lab analyzing this? What can we do for policy? We have a conference coming up, things like that. And sometimes it can become so stressful, that we get lost in that. But remembering that, prioritizing that community benefit should always be our number one focus. Don't get lost in that rat race where we have all these voices and all these people who pull us in many directions, but ensure that these community outcomes are actually useful to the communities involved. And I urge everyone to really rethink good data. By good data, when we do a project and we say, I feel good about this, this was a good outcome, it is not just a complete data set. make sure that it is actually reflective of all communities, all members of that community, whether they are at a lower socioeconomic status or a higher socioeconomic status, whether they have a title or a very fancy job or something like that. Ensure that all voices are heard. Additionally, not just our standardized data set with our Excel spreadsheet that we're going to enter, into our statistical software, but something that is culturally meaningful, something that gives us insight into that culture. Because how are we supposed to, offer insight when policies are being created or, we have these brainstorming sessions? How are we supposed to offer meaningful advice if we are not, looking at that culture as a whole? Additionally, not just looking for comparable data sets. So while there are certain questions, and it makes it easier if we have our standardized test and say, this is, the answer for this population, this is the answer for that population. Now we can do our comparisons. But, finding a way to show that within local realities, to highlight how these individuals are actually living. And, if that data, let's pretend that maybe it is an incomplete set, maybe you didn't get, the turnout that you were hoping, but what you did get was built on trust, it was built on inclusion and community engagement. Pat yourself on the back. Well done. Because although, we can get caught up with the numbers and how hard our analysis will be, if you have built something on trust and inclusion and that community engagement, you have already succeeded. And additionally, design something that captures that lived experience, not just measurable variables. And I know that can be so hard, especially when, we attend graduate school and our research design courses, and they're telling us, this is specifically how you measure this biomarker, or this is how we analyze this DNA, but remembering that the biological things, or even just the health data, the reports that we are getting are coming from living, breathing humans who have full lives that, they are living, who have the same worries that we do. They are still just trying to navigate and get by, but they are living humans, not just a number on a spreadsheet. And so our final takeaway, is that data accessibility is not just about technology. It is not just about, ensuring that the community can log in and see all of these numbers on a spreadsheet, right? It is much bigger than that. It is something that is shaped by cultural norms and social relationships, but also power dynamics. So if we have a group of individuals with power coming in and doing that extractive research and saying, yes, here's your publishable paper, we're not doing good. That is not going to help anybody but the researchers themselves. And so participation depends on whether people feel seen, respected, and also safe. So ensuring that you are doing everything in your power to promote that is absolutely imperative. And so with our ethical data practices, this requires authentic collaboration, not extraction, not just checking a box, not just adding somebody to your author list who maybe has never really even seen your paper before because they are from that region, but actually having our community engaged participation. And so better data begins with stronger, more respectful relationships from day one, not just when we have accidentally fumbled and have to start over from scratch because we used a Western practice that wasn't culturally appropriate. Thank you.
Thank you so much, Courtney. And we can now open it up to the Q&A session. We have probably time for a few questions. I will start off. I took a few notes because I was interested in what you had been saying, and I'm wondering if you can talk a little bit about. You had noted that there was a difference between socioeconomic status in some of the villages between the women. How did you handle, because not only is there a difference between male and female, but also then this difference between like people who have like potentially more protection based on their socioeconomic status versus those who did not. How did you handle that? Because that is another layer when we think about data collection and also just like safety and practice.
Yeah, thank you so much. So that was something that was actually very surprising. We did not anticipate getting any information on that. We did have a couple of questions about one's perceived socioeconomic status and then their perceived social standing. And what we found 100% across the board was the socioeconomic status and social standing always matched. And we really didn't know what to make of that. We did have a lot of questions about income and education level. And so through that, that's where we started to kind of see where these layers of power were. And so although they were not directly spoken about, people were not told you are at a lower status. There were some who identified as part of the matai or the chief's family. I know it sounds very silly, but for those who have seen the movie Moana, it is a very, very similar system. So those, of course, they were recognized members of the community, they were recognized leaders. But in terms of, the villagers, these things were not spoken about. It was not just said, oh, I'm at a lower status, but it was through that we noticed these were the individuals who felt they were at a lower social standing that were afraid to to answer our questions. And so, in order to, make them feel more safe, we first assured everyone that this is completely anonymous. This is something that, nobody will ever trace back to you. There are no identifying factors. We don't ask your name, anything like that. Additionally, we brought in interviewers actually from a different island. So we were working primarily on the island of Upolu in independent Samoa. We brought in people from women's groups on the island of Savaii. So we paid for all their transportation and things like that. So that way, nobody knew what people were saying. So they, could speak freely, share their experiences. And then this interviewer would go back to their island, their village, and nobody was afraid, that they would go tell their mother or their grandmother or something like that, oh my goodness, do you know what they said? So that was something that was really helpful. Again, just making sure people felt safe. And then, of course, saying, if you do not want to answer this question, you do not have to. You are doing us a favor by being here today. So that was the best way that we went about. But again, that social standing was something that we'd never anticipated, and it's not freely spoken about. So having to navigate that was definitely a challenge.
Thank you. We have time for one more question. It looks like one that came through the chat. This is from Heather. Thanking you for the talk. Did you publish anything about this process of starting over and the lessons that you learned?
Thank you, Heather. Yes, we did. So myself and two of my collaborators who are Indigenous Samoan women actually published this paper in the Journal of Samoan Studies. We wanted it to be in a Samoan journal. My collaborators they do identify as women, and they translated it to ensure that it was appropriate. And yes, I did publish about all of the mistakes that I had made. And I do get asked a lot, why would you do that? In research, we don't often publish even our negative results, even if we do an experiment and it's negative. But I wanted to first and foremost honor these communities and have it serve almost as a formal apology. Because at that time, I was a graduate student who was brought on as a project manager. It was my first time in Samoa. I was still learning the language, and I was very excited to, apply all these things that I had learned in school. I was so excited. I actually brought my textbook on the plane with me and was reading it, which sounds really silly. It was so heavy. I don't recommend anybody do that. But I wanted this paper to be a testament that I had messed up and I apologized. And then this is how I went about making it better. And in the future, if anyone had suggestions for me personally to be even better or to continue learning, please, here's my contact information, because I welcome that. Additionally, I wanted other researchers to start questioning their own practices. So, this was my way of showing individuals that, in this region, our one size fits all that we're being taught to do over and over again is not appropriate. And so, do not cause discomfort to this community. It is an honor and an absolute privilege to be there. So make sure you do your homework. So yes, I absolutely published it, and, owned every single mistake that I had made along the way.
Well, thank you. From a recovering academician, I am very grateful for the modeling of that, and that I'll have something to share with people about what it really looks like to have a lot more humility about things that we call facts, when in fact they're
Mm-hmm.
perspectives and ways of practicing in the world that are totally based on culture. Bravo. Thank you very much.
Oh,
Appreciate it.
thank you so much. You're very generous.
Thank you so much. This has been fantastic. And thank you for also making that bridge between the work that you've done in Samoa to also Colorado, because I think we have so many disproportionately affected populations here. And so being able to see that connection is really critical. So we are at time. I'm going to thank everyone for attending this fantastic session and for also engaging in the Q&A. I just have a few quick announcements. Slides and any additional handouts that may be related to this from the speakers will be available on Sketch. This is also a QR code for the conference survey. And we want to assess how we're doing, right? And we really do use this for planning for next year. So please fill this out. And also, so you're aware, I believe there is going to be some kind of like drawing for a registration for next year's conference. So we're trying to incentivize you guys to fill it out so that we have more than just a 36% response rate, right? It's super helpful for our planning committee. We're now going to break for a very early lunch, and I want to make sure that you take that time for your break, whether or not you're going to actually eat, take a walk, although it's pretty gray outside now, or do something else. Our next live session will begin at 12:15. There's going to be 3 presentation options, and all will be ending around 1 o'clock. Please see the full schedule on Sketch to determine which presentation you would like to attend to. Thank you all so much.
Thank you.